Since the United States declared a war on drugs more than 30 years ago, drug-related crimes have multiplied. Current U.S. policies and laws handling drug addicts and drug-related crimes are not helping and even worsening the problems. There needs to be new policies that are aimed at helping drug addicts rather than punishing them. This debate revolving drug-related policies has been a big topic in the United States for many years, and lots of Americans believe that addicts would be better helped in rehabilitation centers. These centers would help addicts safely beat their addictions and turn back into society as productive citizens. U.S. rehabilitation centers can better serve drug addicts. Although rehabilitation centers are not perfect and still have lots of similar issues as prisons, they still are much more beneficial to addicts than prisons are. In rehabilitation centers, there are highly trained staffing and nurses that can help these addicts. And addicts that go to rehab are much more likely to receive the proper medications to help with withdrawal symptoms. One of the biggest benefits of rehabilitation centers compared to prisons is the long-term effects on the addicts. Since rehabilitation centers focus on recovery, they also focus on making sure the treatments help the addict long-term and have programs set up in place to continue helping once an addict can return home. The percentage of addicts who can stop using after leaving rehab compared to prison is much higher. Opiates are responsible for over 70% of all drug overdoses in 2019. And this statistic is very alarming because so many opiate addicts become addicted because they were prescribed opiates from their doctors or nurses after having a medical procedure done. And prescribing opiates has become a very big controversial topic in the United States due to the number of lives that have been destroyed from these painkillers. The process in rehab is also much more personalized to the individual compared to the prison system. There is a personalized plan aimed to help the addict, and there is also a safe plan for detoxing an addict from their addiction slowly, ensuring their body can process the changes without extreme withdrawals. Rehabilitation centers also focus on long-term goals in an effort to keep the patient clean after they are released from the center. Rehabilitation centers will also help patients with much more than just losing their addictions. There are also a lot of programs within rehabilitation centers that will offer assistance in getting a new job, housing, and even getting schooling. And all of these programs are helping the addict to get their life back, which drastically decreases their chances of getting back on drugs. And the rehabilitation services also offer mental health services and a lot of therapies to search for the reason that these addicts are chasing a high in the first place. So many Americans do not receive any type of help for their drug addictions, and millions of people in the United States struggle with drug addiction, and only a seventh of all of those struggling end up receiving help for their addictions. Even with such a low number of people that get help, so many of those people do not receive proper care since they were arrested rather than given help in a rehabilitation center, and the people who were arrested and received their help in prison are extremely likely to continue using once they are released from prison and are even more likely to be arrested again on a drug-related offense. Changing the laws and the policies regarding drug-related offenses would actually save the United States lots of money. The cost of sending people to prison for years at a time is far more expensive than putting an addict in a drug rehabilitation program. Another factor into the financial part of this change is that once someone gets released from rehab, they are much less likely to commit another crime compared to someone who was released from prison. And this also saves the United States a lot of money because the amount of crimes committed and the amount of people needing to be incarcerated will be much lower. People with mental health conditions are much more likely to become addicted to substances. Both people with mental and learning disorders are far more likely to develop serious addictions versus other people. People who suffer from anxiety, depression, autism, and even attention deficit disorder are much more likely to develop a reliance to substances like drugs and alcohol. Oftentimes, people will be able to beat their addictions once they have received help for their personal struggles with anxiety and depression. An addiction goes much deeper than just liking the feeling of drugs and making the choice to continue them. If patients receive mental health care, and drug programs, they would be much more likely to beat their addictions and become happy and successful members of society. Changing the stigmas behind drug addiction is the first step to changing the way we help the millions of addicts in the United States.